Hi, class. We are now at our chapter 10 venipuncture's test review. So let's put our thinking caps on. Okay, starting out, veins bounce, arteries pulsate. Showing compassion helps with needle phobia. The term stat refers to emergency specimens. If a patient is frail and has a tendency to faint, use a recliner when collecting blood specimens. One reason for hematoma formation during venipuncture is the needle is partially inserted in the vein. During a typical venipuncture, the needle should be inserted at a 30-degree angle or less. If arm veins cannot be used for venipuncture, the preferred alternative veins are the dorsal side of the hand or wrist. The first step in the identification process is ask the patient to state and spell his or her name and give his or her date of birth. The tourniquet should be placed 3 to 4 inches above the venipuncture site during a venipuncture procedure. During a venipuncture, after the needle is inserted and the blood begins to flow, release the tourniquet. Ask the patient about latex sensitivity in case the patient is latex sensitive, so you can use non-latex tourniquets, gloves, and bandages. If a patient has a bruise in the antecubital area of his non-dominant arm, consider the antecubital area of the other arm. If a patient is obese, you can use a large blood pressure cuff. That can be helpful in the specimen collection process. It is important to get information about whether or not the patient has recently eaten, because laboratory tests can be affected by the ingestion of food and drink. The specimen collection tube commonly used for hematology tests is the EDTA. Adding too much blood to a sodium citrate tube can cause a shorter clotting time. To avoid specimen hemolysis, the phlebotomist should cleanse the site with alcohol and allow the site to air dry. The specimen collection tube commonly used for hemostasis or coagulation test is your sodium citrate tube. When collecting a blood specimen with the butterfly method and when PT and PTT tests are ordered, use a discard tube and then collect the sodium citrate tube. When using the syringe method to collect a blood specimen, to add the blood into the additive and non-additive tubes, use a syringe device attached to the syringe and insert each tube into the device and allow the blood to flow freely. Okay. So reread your chapter as well. Study any other notes that you've taken. Study your procedures that we've gone over in the previous lectures. And be ready to ace this test, you guys. Bye-bye.